There is help for people who have trouble breathing. Hammond Henry Hospital offers cardiac and pulmonary rehabilitation to help patients recovering from illness or injury that impacts lung function. And Brandy Catton is a respiratory therapist and joins us now with more information. Thanks for coming in.
Thanks for having me.
Okay, so for those of us who may not know, explain, what do you do in cardiac pulmonary rehab?
Well, we do keep our programs separate. Some combine them, but they're patients with heart and lung disease, basically. So our cardiac patients have had either open heart surgery for bypass or valve replacement or repair, or they've had coronary stents, they've had congestive heart failure issues, or maybe even just stable angina. So those are the patients that qualify for the cardiac rehab. Pulmonary rehab is more for COPD, restrictive lung diseases. We're seeing a lot of interstitial lung disease patients. Some long-haul COVID patients have been a part of our program, and then of course there's a lot of different lung diseases, including lung cancer. So those are the patients that come to see us.
So let's talk about the services that you can then provide. You've listed a number of different conditions. How can you help?
So the first thing is kind of nailing down what's going on with that patient. We get a lot of information from their providers that help us with that, but we also spend a lot of time getting to know that patient individually. So I meet with them, or one of our team meets with them, and we sit down and go over a complete medical history, their medication list, kind of what got them to the point where they're seeing us, and then we kind of build an interdisciplinary plan to kind of decide what's going to help that patient the most.
You also get some help from a special test?
For the lung disease patients, pulmonary function tests are kind of the gold standard for who qualifies and who's in need. And I think those are utilized, but they could probably be utilized a little bit more. Oftentimes people are kind of suffering at home in silence. They're short of breath, maybe going up the stairs, but they think they're just getting older. They think they're maybe a little out of shape. So the first thing is kind of talking to their provider so they can, they're not going to know unless you tell them. And I think when you sit in that doctor's office for maybe 10, 15 minutes, depending on how long that visit is, you look pretty good sitting in the chair. So, once you find out that patient is symptomatic, then we can kind of decide what needs to be done. And it usually leads to some testing. The funny thing about heart and lungs are you can have the same symptoms. So we have to kind of figure out if these are cardiac problems or if these are pulmonary problems, or some people have a little bit of both. So that is part of that diagnostic process.
Yeah, that makes a lot of sense. Well, what about the therapy then? What kind of things do you do?
So we have a very it depends. I always tell them any movement is good for them. So we have patients that come in wheelchairs, and we have people that had heart attacks when they were running a 5K. So anything from probably age like late 20s into their 90s are patients that come to see us. So it's a varied group, and that's what makes it so much fun to work with. But we have a full gym of equipment. In cardiac rehab, they're on cardiac monitors. In pulmonary rehab, they're on a continuous pulse ox and heart rate monitor, so that we can monitor them while they get a little stronger, get a little more endurance, and also get a little less anxious about what's going on with them individually. I think that's a big part of it. Sometimes they're not leaving the house much, especially those lung patients. Building confidence. The education that we do in both programs is to make it so our patients can advocate for themselves when they go to that doctor's office. I think everybody wants that visit where, yeah, I'll see you in 6 months, but sometimes there's things going on that they really could make better.
Yeah.
So I think that is the first stop for our patients every single time, and it really is, what makes a difference in their overall quality of life.
Right. I think the message here is be an advocate for yourself. Don't just put up with it.
Yeah.
And there is help there to help you strengthen your heart and strengthen your lungs.
That's what we're there for.
We're out of time, but I appreciate you coming in, Brandy
Catton
with Hammond Henry Hospital.
Thank you.
All right, coming